So, welcome everybody. Think about how a lot of people now are seeking this sense of renewal, and with all the things going on in the economy and the fraudulent bank practices, high unemployment, people losing their homes, material possessions are being stripped away, and it brings people back to look at their values, and many people are expressing this need to have more peace and solace in their life and identify with something outside in themselves to discover ways to live more passionately and profoundly. And the more things change in our world, the more we need to rely on things that never change. And spirituality is that solid anchor in our life, that solid rock that we can hold steadfast to. So we're going to look at the definition of spirituality first. It comes from the Latin word spiritus, which means breath, and it's a concept equated with life. So life begins with breath and ends with breath, and breath provides clarity, calmness, and also this peace of mind. And so the definition we have here, spirituality, is defined in terms of personal views and behaviors that express a sense of relatedness to a transcendent dimension or to something greater than self. And so I look to something outside of myself to find meaning. And for a lot of people who struggle with mental illness, the greatest struggle then is that loss of meaning in their life or that loss of purpose. And so what does the research studies show about the relationship between spirituality and mental health? And so the research now is showing that in the last 2 decades that spiritual and religious practices contribute to better physical health, psychological adjustment, and lower rates of problematic behavior. And if we look at the word religion, it's different than spirituality. Some consider it to be some of the divine origin with a set of revealed truths and a form of worship, and also associated with religious organizations and religious personnel. And Borowski did a study in 1997 where it shows that people with lower religiosity have higher rates of drug use and misuse and drinking and also teenage pregnancy. And spirituality is not the same as religion according to Father Jerome Stack. Everyone has a spirituality. And so spiritual elements are those capacities that enable a person to rise above a transcendent experience in hand. So if we look at the concept spirituality, for some it's a relationship with self, and then our things of the world, self-chosen values, self-chosen beliefs. For others, it's identified with a relationship with God, deity, or supreme being. And this connectedness with God, which is expressed through prayer and or contemplation or meditation. So does it answer the big questions of life? Yes, it does. Depending, some of the questions are, who am I? What is the meaning of my existence? Why am I suffering? And the faiths have answers to these big questions, and they come up all the time in the counseling situations in one-to-one and also in the group counseling. And especially this one, what happens to me after I die. And a lot of clients, they're concerned about their parents as their parents getting older. What's going to happen to my parents? What's going to happen to me? And so they haven't really sorted through these big questions of life. And usually they come to a counselor to kind of, what do you think? And so part of that is just discussing that with them and talking it over with them and going through that process and letting them get out what they do think about some of these bigger questions. And so indicators include prayer, sense of meaning in life, reading, contemplation, and a sense to a higher belief. And so real quick, since it's an interactive group, what I want you to do is just pair up with somebody, hopefully somebody you don't know, And I just want to ask you the question, do you feel you have spiritual needs? And what are your top 2 spiritual needs that you have? And talk to somebody and ask them what their top 2 spiritual needs are. So, and if you don't have any spiritual needs, why do you think that is? So let's spend a couple minutes with this and we'll come right back and keep going. So find somebody, hopefully you don't know, to pair up with and ask them, what are your top 2 spiritual needs? Okay, we got some good, I overheard some good discussions about forgiveness, patience. Okay, let me just have 1 or 2 people share. Kathy, what do you guys call it?
Great, you know my name. It is very interesting because...
Okay, everybody, listen up.
It was very interesting because we came up with the exact same thing, that we just need that higher power to help us go day by day, give us the strength, the peace, the comfort that we need. So that was our number 1.
Oh, great. That relationship then on an ongoing basis. Great. That's really good. And I heard you guys over here go pretty deep. Forgiveness. That was good. Okay. So I want to mention a couple books. How many clinical people do we have? Therapists, case managers? Okay, great. A couple of books, Integrating Spirituality into Treatment, that's by William Miller, is one book. And another book that I found really good, Integrating Spirituality into Treatment.
Is it in your book?
It might be. And I just want to make sure you have these 2. And the other one that's pretty good is Religion That Heals, Religion That Harms, A Guide to Clinical Practice by James Griffin. And so we're seeing that spirituality is very positive, and we know that it works, and now it's evidence-based. And so in psychology, then, why haven't we been using it throughout psychology history? Are sparingly. In psychology, we had some heavy hitters that were decidedly hostile towards religion, and you're talking about Freud, who said religion would be dead by the 20th century, and then Albert Ellis, who said spirituality is just straight out irrational. And so, but now it's different. There's more of a quest to integrate spirituality into treatment rather than alienate spirituality from treatment. And we had these old beliefs about psychology. Humans should always seek pleasure and avoid pain. Well, more spiritual view would be more about responsibility, self-sacrifice, suffering, love, and altruistic service to other people. So we're looking at it a little bit differently. And so I wanted to get into assessing spirituality in counseling, and how do we begin to assess the importance that spirituality plays in the clients that we serve. And from a cognitive behavioral therapy perspective, one of the ways we look at it is we try to get their worldview, and we ask questions. I have 4 basic questions, and I want them to answer these. And the worldview questions, I am, so this is about the individual, I am, fill in the blank. Other people are, fill in the blank. The world is, fill in the blank. And God is, fill in the blank. And so I get a good idea roughly of where a person's at. And in the intake and assessment in mental health, it would be good to have a spiritual type of assessment maybe added to the interview. I know currently a lot of mental health programs don't actually have a spiritual component to the assessment. So that might be something to look at. We developed like 20 questions to get people started in assessing somebody and where they're at in their development. And this is they're suggesting this religious spiritual assessment. And we want to get their beliefs and practices. Does it play a minor role or a major role? And so these are some of the questions on our assessment that we have. What religion did your family practice when you were growing up? How religious were your parents? Do you practice a religion currently? Do you believe in God or higher power? What have been important thoughts about God or higher power? How would you describe God, higher power? Personal, impersonal, loving, or stern? And I like this last question because I can get a sense, and I might even have them draw me a picture of who God is when they're younger, then who God is when they're an adult, to find out where they're at developmentally. And far as, now this isn't in your notes, but if you email, I could send this to you. This is Griffith and Griggs in 2001 did some research. And Griffith and Griggs, and they came up with this means of assessing people in their spiritual identity process, and it's 4 stages. And it's interesting because in psychology we do this developmental stages, and it gives us a good sense of where people are, because we want to start people where they're at in the process, and that's how recovery works. And so stage 1 is what we call spiritual infancy, and it's the stage where people have no interest in spirituality whatsoever, or their interest is in pretty much self-serving, so praying solely to obtain tangible awards. Stage 2 is what they call spiritual childhood. Spirituality is socialized and used primarily to please or live up to expectations of other people. For example, expectations to your parents, pastor, rabbi, those type of people in spiritual authority, right? And stage 3 is spiritual adolescence, where it's a disillusionment and rebellion in which dogma is challenged and the individual is in the process of seeking new answers to fundamental questions. And the stage 4, the last stage, is spiritual adulthood. And this is where they really internalize their spirituality, and it's really at the core of the individual's being. And it becomes really pervasive, and it's included in everything he or she does. And so it's a nice little tool to use to find out where people are at with their spirituality. And we're looking at spiritual practices. Also, spiritual practices, spiritual disciplines, just what are they doing? Utilizing spiritual resources. For example, prayer, meditation, or is it music, or is it hymns, or do they sing hymns, biblical readings, those types of things to reinforce their spirituality. And do you pray? Do you meditate? Do you contemplate when, in what ways? Is it working for you? And this is still part of that assessment process. And here I wanted to spend a little bit of time on spiritual identity because it's an important part. On just going back to finish up assessment, in here on assessment, the idea is to come up with a good spiritual care plan, just like we do a good treatment plan, and allow them to tell his or her story, just like we do in recovery, that makes sense to them and gives them meaning and purpose, and identify client's sense of purpose, and also engage in the client's experience in that pain or in that trauma that's going on in their life, and acknowledge the sacred in that human experience. So, you're in that one-to-one, it's like soul to soul, heart to heart with somebody, and that's really a sacred experience to be in. So in the recovery model, it talks about we're not one up on somebody, we're really person to person. And just like in spirituality, it's the same thing. It's heart to heart with somebody. And we're going to get into this spiritual identity. And I wanted to show you a concept from cognitive behavioral therapy, and it's called a schema. And it's a cognitive framework that helps us to organize and interpret information about people. And in that schema, there's, I want to point out what we're trying to do in cognitive behavioral therapy. I'm trying to move someone to more of their spiritual self. And I'm trying to shore up this. I want to get them away from this negative thinking, the negative core beliefs, the negative automatic thoughts, like I am unlovable, or I am inadequate, I am needy, or I feel ineffective, or I am powerless. I want to move them away from that. I want to weaken that side, and I want to strengthen this side. And I want to move them to their spiritual self. And the schema, if you look at the schema, that's who we are as a person. And think about flying an airplane where they put it on autopilot. It's the same way how we kind of react in the world. We're just on automatic pilot. Sometimes we don't even know or think about our core values, our core beliefs. We just react to situations that come up. So what we're trying to do is identify some of these negative patterns, especially we do this with working in addictions for the people who abuse substances, or in any of these negative self, controlling self, false self, to move them over to the spiritual side. And so I want to get them working on, I am spiritual, I am lovable, I am adequate, I am effective, I'm strong, I'm calm, I'm confident. And once they have a better sense of self, we can move in the therapeutic process better and more efficiently. And so we're going to look at those thoughts and try to change that schema. And so Marsha Linehan has this in DBT where she talks about this unconditional worth. And think about our spirituality. And DBT, thanks for asking, it's a dialectic behavioral therapy. Sometimes I just throw these acronyms around, but it's a treatment modality, and Marsha Linehan is the founder of that. And so she had this experience in church one time where she just felt this presence and unconditional love from God. And so then what she did with it, she called it radical acceptance of self. And so then she said, so you are loved the way you are. So we take you for who you are with all your imperfections and impurities, but at the same time, I need to push you for change, push you to change. And so she was really able to work with really chronically mentally ill people and borderline personality disorder clients and really do some effective work with that, because she's using validation to support them and improving their self-worth, but at the same time, she's using some of those CBT techniques to push them along in the therapeutic process. And to go along with that, we have that serenity prayer in AA that's so important, accepting the things we cannot change and finding the courage to change the things that we can. And so what she calls it that dialectic. So we're trying to move two things toward the center. And so here's the thing, if we don't shore them up with their self-worth, then the problem is that they have this vague sense of identity. They don't really understand who they are, and so which causes them a lot of emotional pain. And so the way people respond to that emotional pain, they cope with negative coping with either blaming, shaming, controlling, or escaping through drugs or alcohol. And so that's the importance of this identity to really get somebody at a better place. So if you're unconditionally loved through your spirituality, we really can make some movement and moves progress. And you see that kind of progress, especially in AA and NACA programs where people are literally transformed. And so how does that work? Well, you know, they strip them down, they surrender to the process, and it's like, I'm going to let go of all the ego defenses, and I'm going to accept God, higher power, or how I understand God, and then I'm going to let Him change my character and make amends to people and take a spiritual path to recovery. And think about how effective AA is in that process. So in spiritual interventions, once we do this assessment, then we're going to start looking at spiritual interventions. And the broad categories is it's either implicit or explicit. And want to look at implicit first. And they are more covert. Counselor does not openly or directly use spiritual resources like prayer or scripture. So, you know, they wouldn't be praying out loud, for example. A counselor may be praying or silently or meditating silently for the client. Explicit interventions are more openly discussed, and that's where we talk about religious material, our spiritual virtues, our praying with the clients, teaching them about prayer, teaching them about meditative practices, or using religious or spiritual rituals. And then the third one is intentional, where we could use both implicit and explicit interventions. And the idea is in civic settings, if we use explicit interventions, we're going to certainly need informed consent signed. And if we're working with kids, we're going to need parental permission. But, you know, in regards to prayer, you know, maybe part of that may be clients taking the lead in prayer, asking them how they feel about it, and getting their input in that process. And same with assessment. You know, we're going to assess them where they're at, but, you know, they may not be ready for spirituality. But, you know, at some point, usually it does come up in the conversation about spirituality. Behavioral interventions, this is Richards and Bergen's research again. Prayer, contemplation, meditation, sacred writings, forgiveness, and repentance. And we talked about 12-step. This would be the case management component in mental health. A lot of times we refer people out to these additional services. And especially people that have a co-occurring disorder with mental illness and substance abuse, and we want to work both of them simultaneously together. And we know prayer is effective according to the research. It's pretty amazing. 90% of Americans pray at least occasionally, and 97% believe that prayers are heard and believe that prayer makes them better people. And so, you know, if I'm working with somebody individually and we're talking about prayer, you know, what I want to find out is, you know, what are the words they use in prayer? You know, just how do they pray? And some people are using the prayer, you know, as like it says here. People use prayer as a coping resource more frequently when their problems are more severe. So is it kind of a last-ditch effort of using prayer, or using it more on a regular basis? And so tell me, how do you utilize prayer? And I think that's part of the intervention process, is to look at that and to make sure that they're using it as they want to, as in a spiritual discipline or spiritual practice. And so what we came up with is a format. These are some of the topics we do weekly. So what is spirituality? Like for forgiveness, like you were talking about earlier, you know, what is that, and how do we forgive? What are the barriers to forgiveness, and why don't we want to forgive? Why do we hold on to resentment, and why do we let bitterness grow? And so how does our spirituality help in that process? And so we kind of, you know, put it on them and let it go around the group. And so we'll take a topic, we'll talk a little bit about like forgiveness. There's in research some ways on how to forgive. And so, we'll lay that out, but more or less it's about them and, how you've forgiven somebody. And if somebody shares how they've forgiven somebody, then it kind of empowers someone else. Yeah, wow, maybe I can do that too, kind of thing. And so we run the group that way, and it's a psychoeducational group. And the thing HR wanted is, if you do this group, Judeo-Christian group, then you've got to have, if somebody wants to do another group, you got to make sure you let them do that other group. Or someone wants to do, it's a meditative group, then, we want to do that group too, and that's fine. And so we said, yeah, sure. We'd love to do some of those other groups as well. And so that was one of their concerns. And the other thing was, you can't make it mandatory, for wellness clients. It's got to be voluntary for group participation. And so let's move on to contemplative, meditative type of prayer. And it's the transcending words and images because of inadequacy of such cognitions to capture the divine. And I want to show you this next slide. This next slide, we're doing quite a bit mindfulness and meditation. And mindfulness means seeing how things are directly and immediately, seeing for oneself that which is present and true, and being aware, acceptance rather than judging one's experience. So, we do these mindfulness practices, but think about just at home, where you're just totally absorbed in something, and or like you're eating a good meal if you're by yourself and you're not thinking about anything else but that one meal. And it's that type of mindfulness where we let out all the distractions. And this really helps people with their symptoms because they're so focused on the mindfulness exercise that they're losing track of their symptoms. And even people with really complex voices could take advantage of this. And so I want to just practice two quickly. We'll do one now and one later in the presentation, but let's do this mindfulness exercise. And so I'm just going to walk you through it. It's a little script that I do. If you want this, you could email me and I could send it to you. But just get in a relaxed position, 2 feet on the floor. You can keep your eyes open or closed. And we're going to do what they call a mindfulness exercise. And what you're going to do is focus on your breathing. So I want you to take a few deep breaths and notice the flow of air as you inhale. And then gently exhale, again noticing the physical sensation of your out-breath. Throughout this time, your job is to pay close attention to your breathing, breath by breath. And I want you to breathe in through your nose and breathe out through your mouth. Allow your breathing to relax and gradually assume a natural pace and rhythm as you first inhale, then exhale, slowly and deeply. Pay close attention and deep attention to the physical sensations that accompany each in-breath and out-breath. Notice that your breath is cool as it flows in the tip of your nose and warm as it flows out as you breathe in and breathe out. I want you to breathe in peace and calmness and breathe out anxiety and fear. Breathe in peace and calmness and breathe out anxiety and fear. Notice the rising and falling of your chest or abdomen as you take each breath, as you breathe in and as you breathe out. Be relaxed but aware observer of your breathing process that it occurs naturally. And if you become distracted, just gently bring your mind back to the room as you breathe in and breathe out. And continue to breathe in and breathe out. And now I want you to turn your focus to a safe place. It could be right here in the room, or it could be on the beach or the mountains or the forest as you breathe in and breathe out. See yourself in that place as you breathe in and out. And what do you see as you're walking around, as you're breathing? Continue your breathing as you breathe in and out. Notice the sounds around you as you breathe in and out. And feel the cool breeze on your skin as you breathe, as you walk, as you breathe in and out. And just notice the sights as you continue to move and breathe in and out. So now I just want you to return and come back to the group. And that's the end of the mindfulness exercise. So hopefully you had a chance to just kind of refresh a little bit, recharge, or I hope I didn't put anyone to sleep. Too relaxed. So Marsha Linehan also does a lot of that in dialectic behavioral therapy, those mindfulness exercise. And think about the mindfulness exercise as part of the spiritual growth. And remember, we're trying to move them to that spiritual self. And so if you're doing those mindfulness exercise, you could do that and get away from the negative thoughts or the negative beliefs. And so it's a good practice to get into. And it's working on also controlling your emotions as well. So sometimes we get caught up in the emotion and we're more or less running on our feelings. And we don't want to be a slave to our feelings. And so we're going to move on now. And this is the 12-step program. And it's a spiritual plan for recovery. 3.5 million individuals attend annually, and it does endorse a spiritual plan to recovery. And it's really an effective plan, and I just wanted you to have some, information on it because people are going to be going to AA or NA or CA, whatever that is, but you'll hear this word surrender tossed around in recovery centers or circles, but surrendering, it's a positive thing. And it's not a foolish emotional response, but it's something that is an intelligent decision. And it really can change, your perspective on recovery and spirituality. So here's the fact. Everyone surrenders to something or someone. And if it's not God or higher power, then it's the opinions or expectations of other people, or it's surrendering to money, surrendering to pride, surrendering to resentment or being bitter, surrendering to lust, or just surrendering to your own ego. And so the 12-step program really has a good program to break down the ego and the ego defenses and change to a more course of a spiritual path. And surrendering means that I have to take the hands off the wheel, and the wheel of the car, more or less, right? And discover His strength and move with that, and knowing that He'll never leave me nor forsake me, not even for a second. And so that's the power of this program with AA. And in the words of Bill Wilson, the central fact of our lives today is that absolute certainty that our Creator has entered into our hearts and He is commenced to accomplish those things for which we can never do ourselves. And so we're going to get into the three major theistic religions, Judaism, Christianity, Islam. And the five Eastern spiritual traditions of Hinduism, Buddhism, Shinto, Confucianism, and Taoism. And all of these religions and spiritual traditions agree that human beings can and should transcend hedonistic and selfish tendencies to grow spiritually and promote the welfare of others. And belief in afterlife is really widely accepted in the U.S., and 3/4 of Americans believe in the afterlife. And also there's been some research in the impact of spirituality on major depression, and it says lower levels of depression among those who held a belief in afterlife, and that was done by Alvarado and Dobson in 1995. And also Richardson Bergen did some research about that, and depression is less likely among religious individuals with medical illness or religious surgical patients as compared with their less religious peers. And so once again, we know it's important to talk about the afterlife, and if we're not talking about it, then there's, I'm sure, a lot of anxiety associated with what happens to me after I die. So let's look at Judaism. 14 million worldwide, 5.5 million in the US. And part of this is the spiritual competency, cultural competency, that trying to learn about the other faiths and the other traditions and get some understanding. Because people come to you and they have maybe they're part of the major faiths, or they have bits and pieces of these different faiths. And so it's good to understand these and get more knowledge on these. So in Judaism, death is not the end of human existence. And this is kind of general statements, but some Jews believe souls of righteous dead go to similar place to Christian heaven and waiting for the coming Messiah. And the Jewish study of the Torah is really important, the name of God's laws, and it's a central activity in Judaism. And they live in accordance with laws to teach them to their children, and this brings a lot of meaning and purpose to a Jewish person's life. And so let's go on. In Christianity, and vast majority of Christians believe in heaven, in which they enjoy presence of God. They also believe in hell, where sinners are punished. And our Catholic brothers and sisters believe in purgatory, a temporary place of punishment for Christians who die with unconfessed sins. And some of the main tenets of Christianity: man rejected God by disobeying his word, which brought evil in the world. And then to restore fellowship with him by placing man's punishment on his perfect Son, Jesus Christ. And then Jesus died for the sins of humanity and rose again, defeating the power of death. Islam, resurrection of bodies. There's 1.3 billion Muslims. This started AD 610, 5.6 million in the US. Resurrection of the bodies. Paradise, also called the garden, is a place of physical and spiritual pleasure. Lofty mansions, delicious food and drink with virgin companions. Islam means submission to God. They believe in one powerful God named Allah, and Muhammad is his prophet. And the main tenet is the 5 pillars of Islam. Knowledge that there is one God, praying 5 times a day, fasting on Ramadan, making a pilgrimage to Mecca, and also almsgiving. Buddhism, reborn into another body, reincarnation. And Buddhists with enlightenment will achieve the latter. Nirvana is the final stage of liberation from cycle of death and rebirth and end of suffering. So there's 376 Buddhists, 376 million Buddhists, worldwide, 2 million in the United States. And this was developed in the 6th and 5th centuries. Buddha sought a way to end suffering, and the way to overcome suffering is to follow the Eightfold Path. Eightfold Path is right understanding, right thought, right speech, right action, right livelihood, right effort, right mindfulness, right concentration. Hinduism, reincarnation into a better status, good karma. If a person has behaved well, if one was bad, he can be reborn and pay for past sins. And a Hindu worships many gods that are all various forms of the one called Brahma. And Hindus believe in the reincarnation, and your karma is based on the actions of your previous life that determines the good or bad circumstances of the present. Confucianism. And Confucius stated afterlife is beyond human comprehension. And so then the goal of life then is to just lead this good moral life through education, self-reflection, and self-effort. And it's not a religion per se, but more of an ethical code. Taoism, a universe composed of the negative force of nature, yin, and positive force of nature, yang. And these two fundamental principles are in the cosmos. And separation means end of human personality as such, yet yin and yang principles survive. And so this is an ancient Chinese philosophy that seeks to harmonize oneself with nature, and they follow the Tao or the way, and you're aligning yourself with the yin and the yang. And this is ancient Egyptian. Just to give you a little bit of history on this, the afterlife was required to be preserved so it could be reunited with the soul. But this is not current Egyptian. Current modern Egyptians are either Muslim and or Christian. Or Jewish, sorry. Thanks, and I stand, thank you. Appreciate that. Shinto, the way of the gods. This is Japanese, 100 million people, and they believe in this divine being or special force called kami. And this is similar. The soul finally leaves the world and it loses its individuality and becomes this part of this larger guardian or cosmic spirit. And it's like it's losing personhood and individuality and merging with that guardian spirit. Okay, I'm going to keep going here. Spiritual practices. So, we're going to look at anointing with oil. So these are also those interventions. And remember we talked about the explicit intervention. So these are some of the things that people are practicing, and you'll see this in mental health and also public health. And so just becoming familiar with some of these. But anointing with oil, that's religious ritual, including placing of oil. That's usually associated with laying of hands for like a major, or anything really, when it's traumatic or just trying to help somebody, restore somebody back to health. And aromatherapy helps people with sleep, anxiety, and depression. Art is really a creative way to get feelings out. And I remember working with a borderline client, and this was a great way for her to start until she could verbalize getting her feelings out. Breath prayers, intercessory prayers, Tonglen. Breath prayers are just those short 6 to 12 syllable prayers. Open my heart to your love, or Lord, give me peace, as you're breathing in and breathing out. Question?
What's that? Tonglen, what is that?
That is a Buddhist word for giving and receiving. It's a form of meditation to cultivate genuine compassion. So let me give you a short prayer. So, may I be at peace, may I be healed, may I be safe, may I be happy, may I be healthy, may I be at ease, may I have compassion in my life. And so these are short little prayers that we can say just throughout the day to kind of get us going, helps replace those negative tapes.
I'm just curious, how much of this, is this, this model taken from the 12 steps as far as like how, you know, how the 12 steps of believing in a higher source or something? Are you trying to emulate something similar to that, or is it a little different?
It's different. I'm just trying to make people aware and clinicians aware of spirituality and how to use it in the therapeutic process. And because, you know, we've had this history of just primarily focusing on psychology, now it's more about mind, body, and spirit. And so how do we work with people when it comes to spirituality? And part of that is taking an accurate assessment, part of that's treatment, and part of that we're going to talk about too is managing, you know, my stuff. And we call that, you know, in psychology, countertransference is, you know, how am I going to manage that in the room? So if I've got a different belief than you do, how am I going to manage that? How am I going to be able to help you? And so the idea to manage my countertransference is to be able to learn about what your faith is and what it means to you. Or is there any discrepancies in that? And kind of work through those. And, you know, what are your values according to that? And what are your practices? And so a clinical person, you know, has these ways to work with people. They've been trained, they have a therapeutic approach or what we call a treatment modality, and, you know, CBT, DBT, psychodynamic, whatever. And now there's all these evidence-based practices, but so how do you incorporate spirituality with all that other stuff going on in a recovery model?
There is another profession in the medical field that specializes in this, and that's chaplaincy.
Yes.
I myself represent that, and there are other chaplains in the room.
Very good.
The format that we've been put to use in, for the most part, has been to have separate visits with patients in the hospital, and we do a spiritual assessment and we report, but we're not integrated into the treatment model.
Yeah.
I'm wondering if there's something that we could be doing, since we are experts in this,
Yes.
to help
Yeah.
bring it into one process.
Yeah, and I think that's the integration of psychology and spirituality is, you know, really effective practice, because in psychology they've done a lot of this evidence-based research on these effective treatment approaches. And so, you know, some of those really work for depression, like CBT, or to lower anxiety, and now there's also seeking safety that help with some people that have problems with substance abuse and trauma. And so I think that's, I'm not sure what your education is, but, you know, if you get into therapy, I think the psychology and the spirituality is a nice mesh between the two. And because they really go together, I don't see them as two separate.
I was just going to say, I'm both a clinician and a pastoral counselor, and I could integrate both in one session. And it's really, really helpful. And I was trained that I'm not a healer. I'm just a therapist. Therapy is an adjunct to your healer. The real healer is God. Okay, I'm just an instrument to the healing. So you can integrate that. And you can use still the treatment plan and all the stuff that we learn in clinical, you know, therapy.
I know there are other people, I just wanted to say that, you know, it's what the interesting thing is, what's really good about this is the fact, if I have someone who's working with me, and I'm a person of faith, and I'm hearing my therapist or talking that kind of language or stuff that I'm like, hey, you know what I mean? It makes me feel more comfortable, and it makes me feel more, I have a much more confident and trusting way and building my relationship with my therapist, because I'm like, you know, it's just like, if you're going to be operated on, you would rather have a doctor who's a praying doctor than one who doesn't pray. You get what I'm saying?
Yeah.
So, you know,
Very
it just
good.
makes you feel like, yes, I want this. I
It's
like
really
this.
assuring, isn't it?
Yes, it's very assuring.
Okay. Well,
I just want to make a comment on the Tong Len. What you mentioned is relatively simple Buddhist instruction. Tong Len is extremely difficult, belongs to the highest Mahayana Tantric Buddhism, where you substitute yourself for the suffering of others. And I don't think that many of us can do it.
yeah.
His Holiness the Dalai Lama can, and maybe a few other high lamas,
Right.
but not the rest of us.
Okay, thanks for the clarification.
I think what I'm hearing though is, as we're trying to do this thing we call integration, one of the things I've been struggling with has to do with, are we bilingual, you know? And is it really about integration? Or is it about, you know, being bilingual, two paths?
Right,
That you can
yeah.
speak the language of both. Do you really belong to them?
Uh-huh.
And one of my experiences has been, though, from the spiritual side, or particularly from the Judeo-Christian perspective often, that we have not necessarily wanted to engage in the psychological, there's been resistance. Versus on the other side, they've been more amenable and open to a paradigm shift in hearing it. So I think we have, I mean, I speak for myself as a believer, as a Christian, in terms of my own belief, is being able to engage and open my mind without fear, that I can stay grounded, but yet still engage in these dialogues.
Yes, yeah, no, that's a nice reframe, that bilingual. Yes.
Okay, I was just gonna say, kind of responding to the, I'm calling him Wednesday.
This gentleman,
Uh-huh.
this fine gentleman.
Yes.
Okay, well, anyway,
Sure.
I had some kind of, a couple of ill feelings towards the integration of the spirituality part. If the therapist was really not spiritual, you're just going through the motions because this is what you're being asked to do. As a spiritual person, I would probably pick that up and say, he really, yeah, or I could see some resistance on the part of the therapist. Okay, I'm gonna go to this in service, I'm gonna learn all this stuff, but I'm really not gonna implement it because I don't believe in God.
Yes.
So,
And that can be at an unconscious level.
yeah.
The intent can be there.
So, but I do think it's important that even if they don't implement it, that they're aware of it in case you have someone to come in, like this young lady on the end, to implement it because you have issues with it.
Yeah, and no, that's really important. We have to, as therapists, be aware of our own beliefs and how they kind of come out in the therapeutic process. And just to talk a little bit about that, because that's part of the boundaries, countertransference, and that's the positive or negative biases we have about spirituality and religion. And so, you know, in looking up some of that information, the idea is not to view a client's religious or spiritual beliefs as irrational or have fantasies of rescuing the client from negative consequences. And, you know, like, hi, oh, silver, here I come to rescue them. We're involved in discussions of philosophy. You know, you don't want to go there and get in that power struggle. You know, you don't want to argue. The idea is you don't want to label a client's change in religious or spiritual beliefs as positive or negative without exploring the meaning behind those changes. So the idea in managing our countertransference, what comes up in the room in therapy, is explore both the positive and negative views regarding religion and spirituality, and experience religions that are different from the therapist's own beliefs, and be familiar with the difference and similarities between the spirituality and psychotherapy, and certainly become involved in our own spiritual growth, right? And learn more about assessment and treatment, and that's kind of where we're at. We're learning more as clinicians about assessment. DMH is sponsoring these trainings. They just did one on assessment, and a lot of it was focused on that, the FICA assessment, which was really good. And so, and then we're going to talk more about treatment, and we talk about that in supervision, and so we get better as we go in this process. So we're going to be better clinicians as a result, right?
I happen to be working for a client run center, and this has been brought up, all right? I'm not a clinician, I'm not a therapist. How do I engage in developing a program or curriculum with spirituality by using this, like what you have here? Am I eligible or able to facilitate it?
Yeah, because DMH, maybe you could speak to this as well, they're developing these community-based, evidence-based type of programs like this. You want to speak to that?
Right, and then also, too, you talked about the FICA, the tool
Yeah.
for assessment. They're also going to be coming up with their own assessment. So there's going to be several, that you can choose from, but Department of Health will come up with an assessment tool. So you can take it and whatever fits your program, you know, you can integrate it. But it's something, a tool to give you, to help you. And that's what the trainings are about too.
Yeah. So then, you know, you could set up maybe 12-week class. Yeah, you could email me and I could kind of give you a kind of a format, a structure to use. Oh, good. Okay.
I am using that, and I did learn that from the last, I guess, DMH training that was here in Tokyo. Yeah, so, and, but I just wanted to know if I was okay to do that, because, you know, when I don't have any license or anything like that, I'm just a peer partner, and I'm just,
Well,
I don't want to get myself in trouble.
Right. Well, and that's what we just talked about is boundaries, right? And DMH has some guidelines that they just set up on spirituality. And are those policies and procedures now from DMH?
They're still working on those.
Okay,
things.
so-
It's all in the works, it's all in the
All right.
works, yeah.
Okay.
It all depends who you work for too.
Yeah.
I didn't know
Right.
who you work for, your HR department, or what they want your boundaries to be and what they want you to do and not do, so. You have to look at everything.
So part of it is that we want to become spiritually competent in working with somebody and kind of, you know, explore what their views are, what their values are. And I think that's part of the process. I know DMH doesn't want you to proselytize, and so that's a part of the boundary setting. And DMH does want us trained in spirituality, and that's part of the process. And so, but it sounds like, you know, we have we have a couple peer mentors running this group here, and so we have a basic curriculum on that. So if you want to email me, you can certainly do that. Question?
Yes, could, I don't know if you did this before, but could we have your email address?
Yeah, is it in there, in the back?
I didn't see it.
The last
Yes, but
slide.
okay.
Yeah.
And also I wanted to say, I come from San Mateo County, and we've had kind of like a parallel process of what's happening here in LA. So what we did is we actually developed this assessment tool. It's kind of like a self-assessment tool.
Oh, great.
And so it has just this very, very wide information about spirituality, and it asks people to think about their spiritual life and kind of like rate themselves. I don't like the word rating, but just like it has a scale that we didn't think about a better way to do it. But so the advantage of this is that nobody is measuring anybody. So clients can take this and just at their own pace, whenever they feel like it, they can just complete it or complete the lines they want. And then if they feel like it, they can bring it to their groups or providers or whatever. So I actually have copies if anybody wants.
Okay.
I'll just pass them around.
Just pass them around.
Can I just make a comment?
Yes.
I'm not part of the MH, or I just want to talk quickly about being outside the MH. I'm a private practitioner, and I'm credentialed with a lot, several, at least 15 managed care insurance companies. And when they call me, they refer a client. Many people are looking for therapists who have spirituality-based techniques. And I'm fortunate enough, I'm one of the few in their line of credentialed people that has that in their kind of, you know, skills. So
Part of
I get clients who I really want to, you know, to do work with.
Great.
Because they call me.
Right.
So part of my you know, skill and my credential is faith-based counseling.
Yes.
So people who are looking for that, you know, in any different kind of religion, they come to me. So, and I learn from them,
Very good.
you know, so I just want to add that.
Okay, let's move on then to chanting. This is Om meditation, and this is a very soothing type of meditation. And this certainly helps with symptomology. And there's also chanting of spiritual hymns as well that is really soothing. Confession is a multi-faith practice in reduction of guilt and fear and also shame. Contemplative prayer, centering prayer. So just real quick on contemplative prayer, you know, the other one I promised you was Lectio Divina. Lectio Divina simply means holy reading. And with the Lectio Divina, you know, there's four parts to it. First part is the reading of like the scripture or the sacred text or the sacred writing. You know, what is the text saying to me personally? How is it touching me or resonating with me, or does it disturb me, or does it attract me? And then how does the reading, I meditate on the reading and ponder it and let it sink in from my head knowledge to my heart knowledge. And then I express it and openly and honestly express to God the prayers that arise out of it. And then the contemplation part is the last part, to simply rest on it and to develop a deeper meaning and to feel God's love and peace in that process. And so what you would do, just take, what I've done here is taken scripture, Colossians 3, chapter 3, 12 through 14, and just clothe yourself with compassion, kindness, humility, gentleness, and bear with one another, and forgive one another as I have forgiven you. And you just take that verse and you say it over and over again and let it go deep. And then, you know, what rises out of that? What thoughts come to mind after meditating on that? And so I want to do one more interactive process with you. So today, I want to commit. So we talked about change and how I want to maybe let go of something, and then I want to take on something else to move more toward my spiritual self. And the idea of some of these exercises, we practice them ourselves so we can teach them to other people. So here's the exercise. I want to commit today to put off, fill in the blank. You got to talk to your neighbor about this. You got to say it verbally. And I want to put on what? So let's try to keep it in the spiritual realm, or if it has to go somewhere else, okay. But I want to commit to today to put off. Could be a behavior, it could be a thought, it could be a feeling. And I want to put on what? What do I want more of in my life? What's missing in my life? Or is there that vacuum? What can I fill my life up today? So turn to your neighbor real quick, and I'm going to work with you. Okay, spiritual practice, drumming. Drumming, this is excellent. We did this at the Latino conference, and oh man, what an experience. 30 minutes of just straight drumming. And you're just completely restored after drumming for 30 minutes. And but these bodily rhythms restored. And it offers a way to safely express negative feelings. Fasting, I'm not recommending fasting, but just to know that some people do this, and where they abstain from food, but you don't want them to abstain from drink or water. And so, but why do people fast? Fasting is a separation of ourselves from something in order to offer ourselves in greater measure to God, the divine, or higher power, kind of thing. And so, but just to know that it is out there. People could do a partial fast, not eat maybe 2 meals, go like lunch to lunch. But you certainly want them to drink juices in between. And that's fasting, forgiveness. This is one of the key factors in relationships, is how to be able to forgive one another. And we were talking about that in our Lectio Divina, of forgiving one another. Sure.
Can you make a distinction between forgiveness and reconciliation?
Yeah, okay. Let me see if I can. I would say forgiveness is the ability to, if somebody has done something toward me that I felt was hurtful, I've been able to let that go and make what we call an altruistic gift of forgiveness, just like someone has forgiven me in the past, or God has forgiven me, then I'm going to forgive that person. Reconciliation, I think, is, being in a relationship is a little bit different, but it's making amends, or, keeping the relationship going, keeping the relationship healthy, communicating differences, resolving conflict. I don't know. Any thoughts on that, or is it the same? I would just, no, I'm focusing more on forgiveness itself and how we could use that to move us along the recovery process. Because it's really a barrier to a lot of people where they hold on to resentment and bitterness. What are thoughts?
I think when, my understanding of reconciliation is that there's also the forgiveness. There's a really conscious effort to amend relationships, but at a different level. You want to go higher for a common good.
Okay.
That there's a need that's really greater than the two of you or whatever that conglomeration is.
Okay. So it's restoring and keeping the relationship
It's
going.
restoring, but it's restoring at a higher level, because not restoring would probably mean is a void, that there could be a level of chaos. I can forgive you, but there means that you're willing to work for something better, investing work beyond the forgiveness, putting energy into developing a relationship that's hopefully better than what it was before.
Okay.
I have a question. You know, if you're dealing with clients, so and you're bringing this into therapy, but for example, someone who's potentially like in a DV relationship where they, you know, are abused and then go back to the abuser. And so how do you separate out forgiveness versus repeatedly putting yourself in harm's way? You know, it's not the same thing potentially.
Exactly, it is.
Well, that's one of the things that's very interesting you say that, because that's why I say forgiveness is a very important thing. It's something that when you forgive someone, the person, whoever's the offender or the transgressor, they benefit from it, but you benefit more from it. Because when you don't forgive someone, that's almost like drinking poison and saying, okay, I hope they die behind it. It's only gonna eat you up inside. It's only gonna be a negative to you. Whereas when you learn to forgive them and you go through that process within your own, they may not even know. There are people that you might have a problem with because they may look like someone that persecuted you or something. There's nothing on their part. They may not even be aware that you have a problem with them. So you have to reconcile that within yourself. Because, I mean, if the person doesn't even know why, and you day in and day out with all this anger and all this resentment towards this person, they're not being hurt by it. They don't even know if you exist, but you are being hurt by it. So the forgiveness is very important for you, and then, if need be, I mean, you know, because some people may not even care if you forgive them or not. So if you go to them and say, I forgive you, they'll be like, who cares? I don't care. That doesn't help.
Go ahead.
Yeah, basically forgiveness is an internal process. It's just the individual. It's a spiritual practice. I forgive, I release.
Yes.
Reconciliation involves two people.
That's helpful.
Or change it was basically what I was going to say, because forgiveness can be done without the benefit of the person who is being forgiven. Reconciliation is bringing people back together. There's something to reconcile. I think sometimes, like in a DV situation, you can forgive that person, but you don't want to be reconciled with them. You're now bringing yourself back into harm's way.
So you're setting a boundary. Yeah.
You also forgive somebody who's sorry.
Not always.
Well, you can forgive them if they're not sorry, but I'm talking about
You mean sorry as in a sorry individual.
This side is going to try to reconcile with this side, and this side with the okay, go ahead.
I think with forgiveness, someone can feel that things comes easy. Things come easy to someone who had forgiven her transgressors.
Okay.
Think about that.
Okay, so there's some good discussion on forgiveness, but it's very effective, and it's not always easy to do.
Because it's not always going to be part of the process.
Right.
It depends on how the offense is taking place. If someone has hurt you, if it's unintentional, which it can be, or whether it's intentional. So based on that, you may have to forgive someone without them ever apologizing or trying to make amends for you, because they just don't know any better.
Right.
So you have to be the better person. That's where your spirituality, if you want to use that term, and I have a problem with it, comes, and we forgive them as God forgives us. Okay. But as far as the reconciliation goes, you know, you're using that DV case. So let's say I've got a substance abuse problem, and I loot the house to pay for my addiction.
Right.
Now, you say you forgive me because you know I've got an illness. I can't help myself.
Right.
Are you willing to trust me back in the house again? So you're generally not going to do that, even though you forgive me and understand my situation, until I've changed something, and then because I've changed, now we can start working on the reconciliation process.
Very good.
Excuse me, I agree exactly with what he said.
Okay.
I've learned to forgive someone without someone asking me of forgiveness or saying it to me. And as a young teen, and I grew up with forgiving finally in my heart, and that helped me to move on.
Good. It helps you.
It helped my spirit, my spirituality, and I believe in God even more. But I learned, even though that person didn't say sorry or ask for forgiveness.
Yep.
I grew in with myself in here in my heart, that I forgave, and that helped me to go move on.
Sure.
Yeah.
And
That's
sometimes
very
you
good.
have to do that. Sometimes you have to just forgive without someone that's going to tell you, and that person will die and never tell you.
Mhm.
But then where does that leave you? So you yourself sometimes have to move on and forgive.
So we got one more comment, then we're gonna
Yeah, my
have
comment is that in my spiritual program, I've been taught that I'm part of the people, places, and things, and what I need to do is accept and surrender, and it's a process. It doesn't happen overnight, but I do forgive, and I let that go. And it's my spiritual principles that I have.
Okay, last comment, sir? You want to-
I'll just throw it back since I'm so entrenched in the Judeo-Christian ethic.
Yeah.
In the Lord's Prayer, it asked, and we are praying, that the Father forgives us just as we forgive others who have trespassed against us. So the same standard we use toward them is what we're asking Him to apply toward us. So in some instances where you don't know, you can't ask or won't ask for forgiveness, you have to be the better person and go ahead and release them from your ability to receive retribution and let them go. That's what your approach comes from.
Taking the higher ground. Very good.
Okay, thank you guys for attending. And what do they have to do at the end?